Fetal alcohol syndrome. What is or when is the appropriate time for an unborn infant to consume alcoholic beverages with mom? I realize that 21 is the legal age to drink, but once again, what or when is the appropriate time for an unborn fetus to be introduced to alcohol? Some people have problems of not understanding that there are serious consequences to their actions. What I'm about to say is so plain and simple that Stevie Wonder can see where I'm going. Alcohol misuse is a serious worldwide public health issue that can result in a wide range of physical, psychological, and social problems affecting the individual, the family, and the community. There is no safe amount of alcohol during pregnancy. There is also no safe time to drink alcohol during pregnancy. The term fetal alcohol spectrum disorder is used to define the spectrum of physical, mental, behavior, and/or learning disabilities that can result from prenatal alcohol exposure. The most severe form of the condition is known as fetal alcohol syndrome. FAS belongs to a group of disorders called fetal alcohol spectrum disorder. It is caused when a woman drinks alcohol during pregnancy. This includes wine, beer, and liquor. The alcohol can cause birth and developmental defects in the baby. Causes of FAS. Alcohol can cross from the mother's blood to the baby's blood. It is passed through the placenta. Even a small amount of alcohol can damage the fetus. Doctors do not know how much alcohol it takes to cause defects. The risk increases with moderate to heavy drinking and with binging. But even social drinking may pose a danger. Remember, this includes wine, beer, and liquor. Symptoms. Birth and developmental defects depend on when the fetus was exposed to alcohol. Babies with fetal alcohol syndrome may have the following physical symptoms: low birth weight, small size and delayed growth, small head and eyes, short flat nose, flat cheeks, small jaws, unusually shaped ears, thin upper lips, shaking and tremors, sight and hearing problems, heart defects, small abnormally formed brain, minor joint defects that may restrict movement, teeth prone to cavities, vision problems, and ear infection. As the infant grows, other symptoms may develop also, including difficulty eating and sleeping, delayed speech, learning disabilities, attention deficit hyperactive disorder, lower IQ, intellectual disability, poor coordination, behavior problems, poor ability to control impulses, and problems getting along with other children. Children do not outgrow these effects. Teens and adults experience social and emotional problems. They may develop secondary conditions which include problems at school, inability to hold a job, trouble living independently, mental health problems, alcohol or drug dependence, anxiety disorders, difficulty controlling anger, and legal problems. The diagnosis. The doctor will ask you about your alcohol intake while pregnant. The child's growth will be assessed. A physical exam will be done. The diagnosis is based on history of alcohol use, characteristics of your facial appearance, slow growth, and nervous system problems. Some children with this condition do not have the typical physical features. Their condition is described as fetal alcohol effect and alcohol-related neurodevelopmental disorder. But the parents can help with an supportive environment that provides consistent direction and structure. They keep to routines, establish simple rules, limits, and consequences, praise their child's desired behaviors, and do not threaten. Violence or abuse will increase the risk the child will learn to act in a similar fashion. Remember, alcohol, including wine, beer, and liquor, is the leading preventable cause of birth defects in the United States. In the womb, a baby doesn't have a fully developed liver that can process alcohol, so it can easily get to and damage the baby's organs. Some of the most severe problems happen in the first trimester when the baby's brain starts to develop. But the second and third trimesters aren't safe either. Remember, there is no safe amount of alcohol during pregnancy. Once again, I ask this question: when is the appropriate time for an unborn fetus to consume alcoholic beverages with mom? Remember, there is no appropriate time. Baby is just innocent, and just don't get pregnant if you're gonna drink. That's my theory. And after reading fetal alcohol syndrome, I personally think that the mom should be held accountable and responsible if her baby is born with FAS. Thank you, and have a good evening.